Joining us in the studio now is TVC News Plateau State correspondent Funam Joshua to talk about community spread, case numbers and management of COVID-19 patients in Plateau State. Funam, it's nice to have you join us.
Good morning.
How is Jos?
Jos is fine.
All right, now Plateau State is one of the states who join in with cases of COVID-19 towards the end. It wasn't one of those states at the beginning. We remember speaking with the governor here when there was no case in Plateau State. Talk to us basically about how the people are coping with the numbers now.
Well, it's very unfortunately, just like you said, Plateau State recorded its first case July 23rd. And then from that period of time, the figure keep increasing day by day to where we are. As at yesterday, July 9th, a report from Nigeria's Center for Disease Control has it that 7,000 people from Plateau were tested for COVID-19. And out of that figure, we have 478 confirmed cases.
478?
478. And then out of that figure again, very unfortunately, we lost 14 people and 241 after the treatment recovered and were discharged. Now, the case in Plateau, like other states, we have some group of people that still believes that COVID-19 is not real.
That's one of the biggest challenges everyone is facing right now.
Yes, sir. Yeah. So these people, go on spreading false assertion that COVID-19 is not real and COVID-19 is a big man disease. It doesn't affect the common people, So that has really affected, the situation. We are facing community transmission at the moment, right. like you said, because of the perception. And these people that I'm talking about, I have a privilege to meet someone that he argued, extensively with me, trying to convince me that COVID-19, he believes that COVID-19 exists, but not in this country.
Okay, so my question would be how the government is trying to counter or change the minds of people to understand that this thing exists, the kind of messages is passing across, how it's designing that message to ensure that people, even at the community levels, no matter the level they find themselves, understand how dangerous this virus is.
Yes, the state government, I have to give them kudos. They've gone ahead in, creating different avenues. Like we have they are using these different dialects on the plateau to pass the message. Like we have 17 local governments, and there are different dialects in that within the areas now. The government have been spreading the message of safety, following the set rules, provided by the NCDC, using different, local dialects, using different mediums like mass media, the social media to talk to people, as well as, the government set a task force that, recently they made it mandatory in the case of the face mask now. Everybody must wear a face mask, or else they set up mobile codes that when you don't wear a face mask and caught, they take you to that place. So the government, like I said, are trying their best to reach the people.
But are people abiding by those advice to use face mask or social or physical distancing and all of that? Are people abiding by those?
Yes.
Okay.
I can tell you, I can confirm to you that last 3 weeks, the government take it very serious, And let me confirm to you that in just the state capital, within 3 weeks, out of every 10% that you see, let me say 9 are wearing face mask within last 3. Yes. We were traveling from Jos to Abuja, and I was very surprised. I was discussing with my colleague, what is happening in Jos, within the past 3 weeks now, it's mandatory now. And it's like a norm now, wearing a face mask. Like I said, out of 9 or 10 people that you see, we can only find maybe just 2 people. But everybody now is making it a duty to wear face mask in just the Plateau State capital. I can testify to that.
All right, talk to us about the isolation centers. The point there is, from the reports we get, many of the isolation centers are getting overwhelmed by the numbers increasing. How is Plateau State coping in that regard, and how equipped is the isolation center?
Yes, the state government have tried in that capacity to say that the 17 local government, we have virtually all the 17 local government areas now, we have an isolation center. Some are having 2 centers within the local government areas now. Okay. So in that capacity, the state government have tried in that at the moment.
Okay.